So I want to highlight a chemotherapy safe handling mistake that happened and what could have been done differently to prevent it. So there was a certified nursing assistant or CNA that had floated to a hematology oncology unit. She was taking care of a patient who was actively getting chemotherapy. While she was emptying that patient's urinal into the toilet, she had accidentally spilled that patient's urine onto her wrist. She did not report it, and she later on developed a rash onto her wrist. So, what could have been done differently to prevent this staff's chemo exposure? So, the unit that she floated to should have given her a safe handling training that would have possibly prevented her chemo exposure. She would have been taught that chemotherapy is found in patients' urine and that she needed to wear chemo PPE while handling their bodily fluids. She also would have been trained on symptoms of an acute chemo exposure, such as the rash that she developed, and to report it immediately. Nursing support staff, such as certified nursing assistants and medical assistants who work in departments where chemotherapy is administered, need to get trained on their occupational risk and exposure and on how to stay safe. So, a question that I have for you is what type of chemotherapy safe handling training do you provide your nursing support staff, such as CNAs or MAs? So, I hope you can incorporate what you learned in this safe handling mistake to help improve safety in your organization.